Well, I'm here with Dr. Stein in Mount Vernon. Hi, Dr. Stein.
Hi, how are you?
Good. Dr. Stein, there's lots of people out there who they have a missing tooth, maybe 2, 3, or 4 missing teeth, usually in the back, and they don't show in the front. And frankly, it appears that nothing really all that bad is happening, meaning that it's not so bad to have this tooth missing, and yet a dentist like you will tell us that we got to replace those teeth, otherwise all havoc breaks loose. Can you shed some light on it? Well, what's that difference where we don't feel like anything bad is happening, and yet you say there will be?
Yes. Teeth. It's very important not to leave spaces, because teeth. It's almost like a wall that falls apart. If you take one piece out, then it creates the other teeth will shift into the space. The teeth from behind will move forward. They'll angulate. The teeth from the top will shift down if there's a space on the bottom. So teeth are like a set, and if they need to hold each other in place. And if you take one out, then it starts to cause a breakup of the other.
I see. So basically, a tooth is kind of like a fence. It's all of a sudden, this one start wiggling and woggling, and it makes the other one wiggling and woggling also.
Yes.
And what is the story about? Does it really have anything to do with that people say that when your teeth are missing or otherwise out of alignment, but they go obviously, as you just explained, easy out of alignment when there are teeth missing. So let's say they're out of alignment. Is it true that then you're hurting your jaws and you become crooked, and you might even get tensions in the neck and even headaches and shoulder pain and stuff like that? Does that have any truth to it at all?
Yes, it can cause not being able to chew properly causes can cause the bite to collapse, and it causes pressure on the muscles, and it can cause people to grind their teeth, and there are different effects that can happen. Even sometimes, like if somebody has an accident, it can cause some muscular pain. One thing affects another, and it starts a chain of events so it's easier to take care of it early so that it doesn't progress.
So would it be wise to assume that, let's say, a person who had some type of shoulder pain, headaches, and he tried to go to a doctor, it didn't quite go away, has it for a while? Would it be, especially if he has teeth missing, but maybe if he has no teeth missing, since a mouth can go out of alignment in any case, I suppose, as you said, with an accident, something you don't notice on a daily basis. Would it be wise for that person to go and visit a dentist and say, look, I've head and shoulder pain, can you check my mouth, whether my bite is correct, whether it comes from here, or eliminate that no, it's not from here? Would it be wise to do that for a patient?
Yes, I would say so. And as part of an exam, we check not just the teeth, we do a full, complete an intra and extra oral exam to check for the tongue, check for the bite, and it is important to check the overall condition.
Wow. So it is true that actually, that's quite a big thing, that never mind your missing teeth, which has all kinds of problem, and because of it you probably lose more down the road because they start getting crooked because they have no support. But not being able to sleep or losing some hours of sleep here and there because of headache and tension pain, and even during the day when working, having the attention on a stiff neck. And if there is some way to maybe cure that, it looks to me like that's quite a thing. I'm sure many people don't think about it, that a dentist could help out with that.
Yes. We can do fabricate a mouth guard. It's similar to a sports guard, especially if people grind at night. Today there are a lot of people with stress, or not just today, but People may, whether they be out of work or different family stress, that can affect the teeth, and as part of it, there are different things repercussions that you see, and it may be dental, it may be different, but it's definitely part of an evaluation that should be done.
So it can be fixed, or at least it can be eliminated as a cause of.
Yes.
Wonderful. Well, Dr. Stein, thanks a lot. That's very informative, I think, and I hope the people watching this video find it so too. Bye-bye.
Okay. Thank you. Bye now.